So I'm going to make a quick note here that I am using a screen reader, so hopefully it won't all of a sudden break down on me halfway through here because it's been causing me some trouble lately. I'm also going to note that I have another name here on my slides because this gentleman helped do a study this Christmas over the break on the actual use of data visualizations regarding the pandemic for people who are blind and visually impaired. And I've got some slides about that at the end. So I had to give him credit because he did a lot of hard work on that presentation. So I'm just going to start now. I am not presenting. I'm sorry. Give me a moment. There we go. So in 2020, we all know what happened in March of 2020 specifically. A bunch of us were getting ready to go to CSUN, and the rest of us were waiting with anticipation to see what the product releases were going to be. And all of a sudden, everything changed. I think I canceled my CSUN trip 3 days before I was supposed to leave. And we all waited with anticipation, and a bunch of information was rolling out, and we just didn't know what was going to happen. I'm going to go to the next slide now. So everything went online. It just meant that everything we had to do, our meetings for work, our kids play dates, everything we had to do on a regular basis was now online. I think most of us got pretty tired of our computers pretty quickly. So now what about people with disabilities? What happened to them? We had to, do our meetings, we had to order food, we had to get our groceries, but a lot of these services were not accessible. Thank God for Zoom, because Zoom was. Zoom had been working on accessibility for several years already. So it actually meant a real bonus for people with disabilities that they had to use Zoom a lot more, because now we were on an equal footing with everyone. Most of us already knew how to use it, and the rest of the people were just getting used to being in an online environment. All right, so I'm going to give you a demo of a few pages, and you're going to have to forgive me here. This is the part that's tricky. I'm in Google Drive, aren't I? Let me see here. Okay. Sorry. Oops. No, don't do that. And I apologize. I'm going to not be able to do that demo. I'm really sorry about that. Just get my slides back up. But the two demos I have is a Twitter tweet that had a image of a bunch of emergency information for people. And that image was not alt texted. In fact, it was only text in the image. So there was no purpose for that image at all to be an image. But blind people were not able to get that emergency information. The other tweet I have, or the other link I have there, is to a LexisNexis visualization of one that actually works. It's a visualization that showed people what the actual effect of the pandemic was on the market. And I will share these slides out later with everyone. I think they're actually already on the web page. Am I correct, Lisa?
Yes.
Yeah, so these, you can follow these two links, and I would really highly recommend you play with that data visualization, because it's actually a good one. And it's still very complex, and it's still very hard to use for a person using a screen reader. I truly apologize that I cannot get those demos up for you. If we have some time at the end, I may change browsers and get them up then. All right, so now what can we do? We've got a lot of options and a lot of things that need to happen after the pandemic. This slide was written before we were getting close to the end. I don't think we're at the end yet, but let's think about where we're presenting information. How many of you here, and you don't need to answer, this is rhetorical, but how many of you here, have data dashboards that your organization or your company is creating with information on COVID vaccinations and so forth? Those data dashboards are very complex and very, very difficult for people with visual impairments or people who are totally blind to read. Visual impairments, they can't navigate a lot of those dashboards because they are images and images only. So lay out your text, spread your text across the page, tell people, don't just give them a bunch of numbers, give them information like there are, 5,000 new cases in X. There are 3 cases currently in our location, things like that. Don't just give people a data visualization. And you'll see why when we get near the end of this presentation. Okay, this one's really important. This one's not an accessibility point. This is a point for everyone. When we first started the pandemic, we just were being inundated with, there's thousands of cases here, there's thousands of cases there. People were throwing that information up on the screen. It was just going crazy. But did we really all need that much information in one place? No, what we really needed to know is, how is it where I am? What's my community look like? And, do I have to go out today, or should I stay home and be safe and secure? Don't put everything you have on one page. Keep it simple. Keep the information very topical on one page. Then if you need to give more information that's more bigger picture, spread it out on different pages of the web page or website. So make sure that data can be accessed and used by everyone. So if you're going to have these massive visualizations, and let me explain what I'm saying when I talk about these visualizations. Have you ever been to one of those dashboards where as you move your mouse around and you hover over it, things come up and things, it gives you the ability to dig in and deeper look at the thing or focus in on that one area? That's what I'm talking about for data visualization. If you really must have one of those because somebody in your organization insists on it, provide the data in an alternative format, preferably before the visualization on the web page, so that the screen reader user says, here's the real information, and they don't need to actually try and fight with that data visualization. It's not the best solution, but you can provide a CSV of all the data you have. The reason I'm saying this is not the best solution, because again, you might have way too much information in it. So this is a really interesting thing, and I make this slide because I actually saw an organization do this. They had a really clean, really good, low, high contrast website, and they said, oh, but we want to change our color scheme at the last minute, right before they put the data visualizations up. They did not test it for low vision and contrast. And it actually turned out to be terrible for everyone because nobody could see the data points on the data visualization because the background colors they chose were terrible. When you're coming up with your initial, color palette, your design of your website, it's really important and really critical to think about low vision, think about, different ways people are going to look at it. If it's going to reflow for, if it's going to reflow for the mobile view, all those things need to be thought of at the beginning. And then when you have a good design, then you can put your data on it at any time when the crisis happens. Don't go changing just because you think you want your data visualization to look better on a page, and do things like that. Make a good design pattern in general. We had so many problems with low contrast data visualizations. It was not pleasant. How many of you saw governors giving announcements about what was happening in your state? Several of those announcements had no captions or interpreters present. It's just gross negligence that, you go out there, you give a public service about an emergency, telling people that there is a lockdown and maybe there was a curfew in some places, and no captions whatsoever. So you've got this man talking there, looking worried, but a person who's deaf or hard of hearing might not have gotten the message at all. So let's think about this. This is a general thing. It has nothing to do with the pandemic. Once you're accessible, everybody gets your data. So think about this, that if you're actually prepared for a pandemic and your website is accessible, it's going to make less effort for you to put stuff up there quickly and effectively. We found in the market that people tend to work on accessibility, pay about 1/10 of the price when it comes to actually remediating later on. They don't have to, first of all, but if they have to do minor fixes and minor changes, their team is much better prepared and can do it faster. All right, so here's some of my new content that I added to this. I've given this presentation before, and I'm rushing through because I wanted to get to this area. So we did a study, and what we did was we looked at the top, first of all, we looked at the top 100 websites across the nation that were giving out COVID data, had all kinds of COVID dashboards. It was painful. It was extremely painful. I am visually impaired myself, and I had to basically vet these websites and see if we could actually give instructions for the testers that we hired a little later on how to find the data visualizations we were interested in. And so some of these websites had 3 to 4 different data visualizations, and I had to go through, find the data visualizations, and give the screen reader users instructions as to how to find those on the page. And those instructions would be things like, find the third table on the page, then move to the heading above that and start reading, and things like that. But in 3 days, I had to visit 100 websites, each of which had a minimum of 2, some 4 data visualizations. And it was at the beginning of Omicron. And when I did get the data, it was depressing, crushing data. But even worse, most of the time, the data wasn't there. It was non-existent, and I was doing this with a sighted person watching my screen and telling me, okay, yeah, that's the one we want. And so, then detailing the keystrokes. Then what we did was we hired, I think it was about 3 different screen reader users. And those screen reader users were given 30 of these websites each. And then they had to answer a series of questions on each of the websites. So the questions were, were you able to determine the data? Were you able to find out, any trends shown in the data? Could you actually tell what type of visualization was it? Was it a bar chart or a scatter plot, or, was it easy to find on the page? Even though we'd provided them instructions, we made sure to ask the question, was it easy to find? Because, you know, in some cases, the data wasn't there and we knew it wasn't there, but we wanted them to confirm that they couldn't find it. And then here's our results. So this is what we found out anecdotally beforehand. We did some studies, we sent out some surveys across the country. And it was interesting because there were some really good websites out there that had good structure, but then they got to the data visualizations and couldn't do anything on them. So these are things to think about the data visualizations, you know, provide the data for the person available in another format. Make sure you describe and narrate the information. These are the things that our study participants asked for constantly. So now that we're done that, what I thought I would do is I'm going to actually stop presenting. And I am actually going to go visit a few websites for you so you can actually see how bad the problem is for people with disabilities. And I thought I'd start with a good one first. So I am actually going to go to covid.gov. Oops. Oh, come on. covid.gov. I just realized what I'm doing. I'm sorry. I'm a little nervous this morning. Gov. All right, I'm going to take my headphones off now. I'll be hearing my screen reader.
Official government website region, here's how you know button collapsed.
Can you all hear that?
Yes, we can, Lacey.
Change the microphone rate.
Okay, I'm going to slow it down.
Rate 55 out of region, link skip to main content.
So let's take a listen to see how our most recent government webpage does. And this is actually pretty good, I think.
Link skip to main content. Official government website region graphic U.S. Flag. An official website of the United States government. Button collapsed, here's how you know out of region. Banner landmark visited link covid.gov. Primary navigation landmark list with 3 items English. Link Preside enter para cambiar el idioma del sitio. Link Español. Link. Enter. Link. Out of list. Main landmark heading level 1 find COVID-19 guidance for your community. Clickable search for your county to find COVID-19 guidance for your community. Combo box collapsed has autocomplete editable search for your county. Heading level 2 your COVID-19 toolkit. Resources to keep yourself and others safe from COVID-19. So pretty straightforward. There's not a lot of excess information, and they, you know, once they go through the government official stuff, you're pretty much there. So they did something really lovely here. Search for your county to find COVID-19 main landmark. Search for your county to find. Has anybody experienced how some autocompletes work with a screen reader? It's usually quite disastrous. We either don't hear that there's results, or even worse, we will hear that you know, there's results, but we can't get to them. But they did an excellent job here. So I am going to look for my county, the county of Alameda. Expanded. COVID.gov find COVID. And it's broken. I was here just 3 days ago, and that autocomplete worked just fine. Heading level 2 low COVID-19 community level. CDC recommended steps you can take to protect yourself and others. List with 3 items, graphics are in Jicon. And you'll see that I don't actually know what county I'm in right now. Let me go look for the heading. Low COVID-19 community. Find COVID-19 guidance for your community. Heading level 1. Clickable Baldwin County, Alabama. Clickable search for your county to find combo box collapsed has autocomplete editable Baldwin County, Alabama. Search. Let's try it again. When autocomplete.
So I was in Baldwin County, Alabama. Let's try
Expand.
I swear to you, this worked the other day.
110 results are available.
Ah, there we go.
County, Alabama. List.
It's just small. It's just slow today.
Barber County, 3 of 110. 110 results are available. Barber. Bibb County, 4 of 110. 110 results are available. Bibb County, Alabama.
Not sure why it's looking in the B's, so I'm going to go back and try again.
Search for your county to find. 110 results are available. List. Alabama Watauga County.
So what I'm doing, just so everyone knows, is I'm down arrowing once I hear that it has results available. It's very, very slow. My internet connection has, I mean, this is another pandemic problem is some of our internet connections just can't handle the stress of all the Zoom calls we're doing.
Baldwin County, 2 of 110. 110 results are available. Baldwin County, Alabama.
So I am not able to find my county. But as you heard, it had very clear. Let me try San Francisco. Come on.
37 results are available.
There we go. Much easier number.
List. Arizona, Santa Cruz County. California, San Benito County. San Bernardino County, 3 of. San Diego County, 4 of 30. San Francisco County, 5 of 37. San Francisco County, California has been selected. Click this clear button to clear search.
Very nicely done.
Heading level 2, low COVID-19 community level.
And I was able to start reading and I got low COVID-19 community level.
CDC recommended steps you can take to list with 3 items. Graphic syringe icon. Link stay up to date with COVID-19 vaccines. Graphic beaker icon. Link get tested if you have symptoms. Graphic mask icon. You may choose to. Link wear a mask at any time. Out of list people with symptoms, a positive test, or exposure to someone with COVID-19.
And it's very simple, clean, concise. So this follows that rule I gave you, didn't it? So now I'm going to go and show you a data dashboard that fails.
Navigation tool selection covid19.health.org/selected. Collapsed. COVID.gov find COVID-19 guidance for.
Come on. Come on.
Clickable banner landmark link in website. Heading level 1 COVID-19 projections. Button skip to main content. Link in website.
So what is that? In website. Anybody have any idea what that means? I don't have any idea what that means. And that's the page title.
Heading level 1 COVID-19 projections. Heading level 1 COVID-19 projections. Link global health data exchange. Link more in visualizations. Main landmark as the pandemic continues to recede, and will update its COVID-19 models and forecasts at the beginning of each month. In the meantime, our researchers will keep track of any developments that might require more frequent updates. Last updated April 7th, 2022, Pacific Time. Link fact, link policy briefings, link publications, link partners. Button use geolocation to find available locations. Clickable, select a location. Combo box collapsed as autocomplete editable. Global. Visited link download results, more information, contact, and share menu. To see results within this country, select a subnational location. Button close this note. Navigation landmark clickable. Tab selected cumulative deaths. Tab daily deaths. Tab vaccine coverage. Tab hospital resource use. Tab infections and testing. Tab mask use. Tab social distancing. Clickable. Cumulative deaths region heading level 2 cumulative deaths. Link external link. Deaths special analysis. Tab selected cumulative deaths trend. Tab cumulative deaths compare. Tab cumulative deaths map. Reported deaths are the number of deaths officially reported as due to COVID-19. Total deaths are the estimated number of deaths attributable to COVID-19, including unreported deaths. Clickable radio button checked. Reported. Clickable radio button not checked. Total. Clickable radio button not checked. Both. 7,018,519 reported COVID-19 deaths. Based on current projection scenario by August 1st, 2022. Scenario. Clickable link more scenario information. Select one or more scenarios. Clickable.
So you'll hear that I had to go through a lot of information that was just pick my filters. And then all I got was one number. And that one number was a pretty large number, but what about all that other information that I wanted to see? Can I go back and change the reported deaths to projected deaths? Let's try.
More scenario information link. Clickable.
Oh, I just tabbed and I'm on I don't even know where I'm at. I'm probably at a map.
Recorded radio button checked 1 of 3. Total radio button checked. Both radio buttons checked. Total radio button checked 2 of 3.
Total.
Both radio button checked 3 of.
No. So that box doesn't have the projected. So let's go back some more.
Switch between tabs, tab control. Cumulative deaths trend tab selected 1 of 3. Cumulative deaths compare tab 2 of 3. Cumulative deaths map tab 3 of 3.
Nope, don't want that one.
Deaths, external link. Deaths special analysis link. Navigation landmark. Tab control. Cumulative deaths tab selected 1 of 7. Close this note button. Download results. More information. Select the location.
So I can't find the projected, even though I heard a radio button for projected. It's just not in my tab order for me. All right. Let's see. Where else should I take you to talk about this? I think what I'd like to do is now just have a general conversation with everyone about this and give you a few little stories about what I actually saw happening
Desktop
during the pandemic. So let's go back to our Zoom meeting. I'm going to turn off my screen share so it doesn't distract everyone.
Zoom window.
And let's talk about what I actually saw. So on my slides there, I had a scenario that I didn't describe that I will describe now. So as we had to start finding different ways to get groceries, and everybody was bulk buying on toilet paper. God help us, we didn't run out of toilet paper, I hope. But a friend of mine who was totally blind went to the local grocery store and was turned away. The grocery store said they could not help her find the things she needed because they had to stay 6 feet apart and they did not know how to do that. And they would not even think about how to do that. So they sent her home. So this person lived alone and had no access to groceries. She tried to use Instacart, but Instacart was not working for her on her computer. So she ended up having to call out to friends to see if somebody could actually get her groceries.
Your screen share has been stopped alert.
Yes, thank you.
Live speech mode off.
And the other problem that we had here in the Bay Area was that Instacart went on strike about a week and a half after the pandemic, hit its full force. Instacart workers all went on strike and you were not able to get a grocery delivery to save your life because, they were poorly paid and, we had to, suffer the consequences of that. Luckily that resolved fairly quickly, but, there were people who were absolutely reliant on them for their groceries who could not get them. It was a really scary time for people. It was a very frightening kind of, dehumanizing time for a lot of people with disabilities. When it came down to the vaccines finally being distributed, late 2020, early 2021, blind people were not able to go and sign up to get a vaccine. The forms were completely inaccessible. And then if you were signed up to get an appointment, you had to be on web pages that required you to refresh so fast that the screen reader user couldn't actually keep up. And that the refresh of the screen meant that as soon as you actually tried to find the appointment listed on the screen, that appointment was gone. So, I heard horror stories from many blind people saying, I made it all the way through the process and they told me the appointment was taken because as a screen reader user, we can't click on the time and then click submit. We have to find the time in the calendar. Then we have to go find the submit button. And it wasn't working because these weren't very accessible forms. They weren't done in a way that a screen reader user could get through them really quickly. And of course, I don't know about you, but here in the Bay Area, we had 10 different websites we needed to check for those appointments.
you either had to go to the county or you had to go to the state website. Then CVS had their own website. Then Walgreens had their own website. And then Safeway had their own website. And it just, none of them were the same. The system was completely, out of control and inaccessible the whole way through. We, luckily here in the Bay Area had a nonprofit who made arrangements with the state to actually be a vaccination site for people who are blind and visually impaired. And they provided a simple, easy way for blind people to sign up for them and their families to go and get vaccines. Pretty horrifying in general. Today, I still don't get very much information from the data dashboards. You saw what the government once said, low vaccinate or low risk, but that's all I really hear is low risk. I don't hear, which variant it is. I don't know that, maybe one city over from me is worse than mine. So I actually depend on my husband to tell me, is today a good day for me to go down to Mountain View to do some work, or should I be staying home here in Berkeley? So now I want to open it up for questions.
Hi, Lucy. This is Adam with Able Tech. We just want to remind everybody to please ask any questions in the Q&A feature, and I'll read those off as they come in. I did want to go ahead and read some of the chat comments that came in to you, Lucy, because I knew that you had those turned off.
Thank you.
Yeah. And so Deborah says that as a woman with hearing loss, I appreciate the demo of how fast the screen reader works. Excellent job sharing this perspective on accessibility and websites. Thank you.
You're welcome.
And then we also had a couple of, that's so frustrating, what a nightmares, as you were going through some of that, I can only imagine the frustration that you felt trying to navigate and get some of that data. So
it was beyond frustrating. We began to feel, like we were being removed from society. I talked to a lot of other friends who are blind, and most of us were feeling, disenfranchised at a severe rate. We were pretty left out of the information. A lot of people thought it was an information overload. We felt it was an information lack completely.
Yeah, that's unfortunate.
All right. Anybody else?
Yes, we have a couple of questions coming in. So the first one is from Amir, and they ask, did you test these websites with only one screen reader? For example, JAWS, or did you test them with multiple different ones, NVDA, VoiceOver, TalkBack, Narrator, etc.?
We stuck to the desktop only, but we did have a VoiceOver. We had at least one VoiceOver user, one JAWS user, and I think we had 2 NVDA users. So we did test with everything we could.
Great.
The paper that we published on this is due to be released, I think, in May. So
great. Next question from Kelsey. Do you think things have gotten better since the pandemic started? Obviously, there's still a long way to go.
Yes and no. I think the website I started by showing there, the us.gov one, is actually really quite good. I am, pretty impressed with how the current administration is thinking about accessibility and trying to do their best. They still have a long way to go, but it is better. It's not completely exclusive, and it's not, limiting our ability to actually get the information as badly as it was at the beginning of the pandemic. A lot of the websites out there, though, haven't changed. They haven't improved in any way, shape, or form at all. I have a website that for work where I'm supposed to go and get data on exposures. Luckily, I work from home, but I still get the email every day saying, workplace notification of an exposure. And when I go and try and find out, what building it was in, they do provide me with the CSV. It initially was below the visualization. I told them to put it on top, but for the first couple of weeks, I could not figure out what buildings it was in. And I was like, thank God I'm not on campus, because I would never be able to know if somebody in my building actually exposed me to it or not. And that data visualization exists to this day.
Next, we have a question from Sandra. How does Alexa or Siri work for you?
They work great, but I'll give an example. I don't have either one of those in the room right now. I do have a Google Home. Hey, Google, what's my COVID exposure right now? Sorry, I don't have that information about coronavirus. All right, so she knew to change it to coronavirus. Hey, Google, how many cases are in Alameda County for COVID?
According to the New York Times, as of April 20th, 273,111 total confirmed cases of coronavirus disease have been reported in Alameda County. Keep in mind that the data changes rapidly, so it may be inaccurate or out of date at times.
Okay, Google, stop. Okay, Google, stop. So as you see, it's giving me total, but it doesn't tell me how many reported cases this week or today. The other thing that I'm finding very frustrating is that even the best places have changed their reporting mechanisms and changed their way that they do it. So a place that would give us daily numbers is now giving us weekly numbers. And because they're only giving weekly numbers, there's less granularity to the information. Great question, though. The voice assistants are phenomenal, but maybe I don't know how to ask the question, but it's still not giving me a very localized, specific bit of information that I need.
Yeah, I know that devices like that have kind of been a game changer for a lot of people. And but yeah, they're still only as good as the information that they have access to. So,
and it would be easier for the devices themselves to get the information if the pages were created accessibly. Amazon, Google, and Apple do a really good job of data mining pages that are coded accessibly because they are accessible. The data is machine readable. And when it's machine readable, it's screen reader readable, and it's very easy to parse that and put that information into one of these assistant devices. But when it's inaccessible to my screen reader, the chances are when Google's crawling the website or Apple News is crawling the website, they're not going to see that data, and they're not going to be able to interpret it any more than I can. My team here at Berkeley likes to say Google is blind because the crawler uses a lot of the same information that the screen reader does to interpret, what the data is on that site.
yeah, no, that's a great insight. Next, we have a question from Cynthia. Is there a particular screen reader that you recommend?
The one that works for you. That's a terrible answer. I'm sorry. So I personally prefer NVDA. Tons of blind people like JAWS. They say it works really well. There are a small minority of people who do use VoiceOver on a Mac desktop. All of these things work for people in certain situations. I will never say use one screen reader over another. And in fact, I know how to use all three of those because in my work, I have to use all three of them. I like NVDA for some reasons. I dislike it for other. I like JAWS for some things and I dislike it for others. I am not very comfortable with VoiceOver for Mac, but it does a reasonable job as well. They're all, depending on what the tools you have to use are, what you're interacting with the screen reader might vary and might differ.
Deborah asks, she would like to get the link to your website again, if we could get that. And then do you have a good checklist or resource list for agencies who ask if their website is accessible to vision impaired or blind?
Yes. So the website we have at Berkeley is web access, one word, .berkeley, BERKELEY.edu. And I believe on the homepage, we actually link to our DYI checklist that we ask people to use before they come to us for a review, because it's things that anyone can check on your website. It's a really nice, simple way of going through your website and looking at the different things that are easy for almost anyone to test before you go to an expert to have them help you with your website.
Great.
And there's tons of other resources on there.
That's good. Speaking of kind of additional resources, you mentioned that you have a report coming out soon, and Marcia, and I'm sure a lot of other people are wondering where that'll be made available once that goes live.
I'm not sure where it's supposed to be. It is done through the Human Computer Interfaces Association, so they are publishing the white paper. If you email me in about a month, I should have a link to it then, and I will, anybody who emails me, I will send out the link to it. It may be a 4-page article, sadly. I was just the person who was the screen reader expert on the study. I wasn't actually the the person deciding where the paper was going to be published.
Gotcha. That's understandable. Next, we have Danae, who asks, I'm someone that uses JAWS to test things like websites, PowerPoints, PDFs, etc. Can you share some of your favorite JAWS keyboard features that could be useful for someone who's not a native screen reader user?
I never, ever suggest that a non-native screen word user use a screen reader to test. The reason for that is that screen reader users have very unique, very individual ways of doing things. So some people will go through websites by looking at the headings. Some people will just listen to the text. Some people will go by links. It's always best to try and find a person who is a screen reader user to help you test. There are some great resources out there, though, that can help you test your content so you look for the elements that a screen reader would look for, as the W3C bookmarklets. And Paul Adam has some really nice bookmarklets as well. I don't have a link to Paul Adams, but if you give me a moment, I can actually bring up the W3C links, and I'll post that link in the chat, actually.
Yeah, that'd be great. Thank you.
And here we go. This is the link right here. And need to go back to the meeting. Here is the link. I hope. Sorry, when I have turned the chat off, I don't even hear if I got confirmation that I posted the right thing in there. Did that work?
Looks like it did not, but we can.
Yeah, we can grab it. Lucy.
Okay, yes. So it's the W3C bookmarklets, and what those will do is it will show you where your headings are and what level they're at. It will show, there's one that will show you what the images are on your page and expose what the alt text is so that you can see if you've actually put the right alt text on it. It'll expose form fields and show you what the labels are for those. That is a better tool for a sighted person than a person trying to learn how to use a screen reader. Unless your job is 100% testing with a screen reader, then that's a different story. And I would suggest that you get very familiar with all the different dialogues of links and headings and graphics. That's the way that you can actually use the screen reader to test. We had a developer once try to learn how to use a screen reader against my recommendation. And he couldn't figure out how to get the screen reader to read the text on the page. He was very confused and he had no idea what he was doing. So he added tab indexes to all the sentences so that as a person tabbed through the page, they could hear the text. Well, screen reader users don't use the tab key to read the text. We use the say all functionality. But what he ended up doing was making that page actually horrifyingly, horribly hard for a person who was a keyboard only user that was not using a screen reader. Because now they're having to tab through huge blocks of text and every sentence was a tab stop. It just, unless it's your job to use a screen reader or you are a blind person who depends on a screen reader, I do not recommend learning a screen reader.
That's great feedback. Yeah, sometimes, trying to fix the problem, you cause 1,000 more. So.
And I mean, it's best to actually get the person who actually has the impact, because then you can actually see emotionally what happens with them. You can actually, get their feedback on how possibly it would be better for them. And let's face it, people with disabilities are highly unemployed. So let's make some jobs for people with disabilities. As long as they're skilled at what they're doing, it's a great job for somebody who might not otherwise have the ability to work.
Oh, that's great. Next, we have a question from Deborah. And what is your opinion on how accessible Zoom's account page is for people who are visually impaired or blind?
It's busy. It's very busy. It's got a lot of stuff going on, but it is usable. I mean, it's not painless, but I'd say it's quite usable. And they are very open to feedback. So the last time I actually tried to create something and use accounts, I did provide some feedback and they did fix it within a week. So it's been a long time though.
Well, that's good. Yeah, I mean, it's good to know that you can reach out, to a company and they'll actually take that request seriously.
And there's a reason they won the pandemic, the pandemic top meeting thing. I mean, people don't talk about going to meetings anymore. They talk about going to Zooms. Right. And there's a reason for that. It is actually a very usable tool.
Okay, it looks like we have one final question from Cecil. And they say, if users notice these sorts of things with important websites, should we notify the site or content creators where possible? So this leads into what we were just talking about. For example, an image-only health notice page with only unreadable text.
God, yes, please, please do. Because it ends up leaving it to us, otherwise, the people who are impacted. And after a while, as a person with a disability, you get tired of being the one to report and complain. And, I mean, I'll give you an example that has nothing to do with the internet, but, those of us who are dog users, after a while, we get tired of complaining about the fact that Uber is rejecting our dogs or Lyft is rejecting our dogs. So they just call another one and they move on and they just wait and they don't even bother complaining to the companies because it just becomes an incredible burden. So if you see it, you report it, share it on Twitter, shame them. I don't care.
Yeah, no, that's great. Okay.
Again, the slides are on the Access Tech website. Did you share the link to them, Lissa, or did you actually create a PDF of them?
Go ahead, Adam.
Sorry. Yes, we linked directly to your Google.
Yes, so you'll have the updated slides with the information. And please reach out to Dan if you want more information about the study as well. Dan is the primary author on that. And his information is on the slide deck as well.
Excellent. All right. Well, thank you so much, Lucy. This has been super informative as per usual. I love hearing your content and learning from you. So you were the last step. So thank you for being, bringing it home for us for this conference. And we'll let you kind of shift off. You feel free if you want to stay in the chat and hang out for a little bit. But otherwise, I'm just going to close out the conference and we'll get everyone the slides and everything later once we have them updated.
Thank you. I really appreciate it. I will stay along in the chat. I have to go turn it back on, or could somebody read those to me?
You're getting a lot of thank yous. You're getting thank you so much, great info, thanks all, etc. So lots of good feedback there for you.
All right, and thank you. I wasn't quite on my game this morning, so I appreciate that you guys enjoyed that.